Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, October the 28th. We are in week 34 of the COVID-19 pandemic here in Montgomery County, the 18th week of the green phase. Welcome to our afternoon press briefing. Today I'm joined by my colleague, Commissioner Ken Lawrence. Since the October 27th press release, we have 92 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 13,534. These positive cases are a result of a positive test for the virus, not from the antibody. 3 of these cases are from long-term care facilities. 89 are from the community. 86 of today's tests are from the last 7 days or less. 5 tests are from 8 to 14 days ago, and 1 test is more than 14 days old. These positive individuals are from 33 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 6 years old to 87 years old. And as always, you can check our county map found at www.montco.org/COVID-19 for updated geographic information. Today we have 50 females and 42 males. I am pleased to confirm that no additional Montgomery County resident has lost their life to COVID-19, which leaves us at 838 deaths confirmed positive from COVID-19. For many weeks now, we have discussed and public health experts have predicted that we would see a surge in COVID-19 this fall. Today, I want every Montgomery County resident to understand that the COVID-19 surge is here in Montgomery County. In the last 7 days, we have seen 571 new cases, which is an increase of 237 cases compared with the prior 7 days. Our positivity rate is increasing. We're going to show you our usual 14-day average positivity rate. It is now up to 3.16% as of last Friday, October the 23rd. That's compared with 2.31% on Friday, October the 16th. However, given that we are entering a period of rapid change, I also want to show you what has been happening on a daily basis rather than the running average. This graph is the daily positivity for each day for the 14 days ended on October the 23rd. You can see that our trend is moving upward. Our hospitalizations are also increasing. Today, 70 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is a 54% increase in hospitalizations from last Wednesday when I last reported these numbers. Let me repeat, it is a 54% increase in hospitalizations from last Wednesday. 8% of these individuals require a ventilator. So why is this happening? Well, first of all, we have cooler weather, and cooler weather has 2 impacts. First, the virus can stay airborne longer in colder air, so it has more opportunity to infect someone. Second, cooler temperatures send people indoors at restaurants and for social gatherings. We also have more people going back to a workplace and more students going back in person to school. Finally, everyone is tired of COVID. And because our Montgomery County numbers have been pretty good for a long time, people have been moving around more, and some have gotten a little more lax about mask wearing and social distancing, and others are still not wearing a mask and ignoring guidelines. But we do have to remember that we are all in this together, and not just in our county, but across our region. Social gatherings and youth sports and recreational activities continue to be our biggest challenge. And I'd like to share a story with you from our recent contact tracing. This story starts with a student who attends a private Philadelphia school where there was an outbreak. This student went to a private recreational activity in Philadelphia where there was an awareness of the school outbreak, but the activity went on nonetheless. From participation in that activity, a different student was exposed and participated in a different recreational activity in Montgomery County, while contagious but without symptoms, and passed the virus to 5 adults. 2 of those adults were coaches at different youth recreational activities, where we now have 2 school-aged individuals testing positive and possibly more. So this is an illustration of how quickly this can spread, how individuals who are contagious but don't have symptoms can infect a number of individuals, and then those individuals can continue to pass the virus. So now the question is, where are we heading? Well, today the CHOP Policy Lab is posting updated modeling for our region and what is likely to happen given current trajectories. Now, I want to be clear, this is a modeling based on us doing absolutely nothing different. Our mobility around the county stays the same. The number of people wearing masks stays the same. The number of people having parties and other social gatherings stays the same. And this is the data for Montgomery County. So you can see, as evidenced by the historical line, we've been pretty flat for a very long time, as I have been reporting and sharing with you now for many, many weeks. But what is concerning is the line that's in this red box, that their current modeling shows that we could have a very dramatic exponential surge of cases over the next couple of weeks if we don't change some of the things that we are doing. We're seeing this in other ways as well. Now we're going to show you our graph that we call the date tested graph. Just as a reminder, this is the graph that shows the number of daily cases and running averages by test date. So as a reminder, those gray bars in the background are the number of people who were tested on any given date. The red or darker pink line is our total 7-day average, and the lighter pink line is the total 14-day average. And then the 2 lines represent our community 7-day average and 14-day average. So let's go ahead and zoom in on this. And so this is our data for the last 30 days. And you can see that we're seeing a significant uptick in the 7-day average for both the total number of cases as well as the number of cases from the community. And if we keep on this trajectory, that 14-day average will be soon to follow. I do just want to point out that way down at the bottom near 0 are our long-term care facility 7- and 14-day averages, and they remain very, very low. So unlike our situation back in the spring, this is nothing to do with long-term care facilities. This is all about people in our community. So what can we do to flatten this trajectory? It's really important to take these mitigation measures and use them together. And as an illustration of this, I'm showing you something called the Swiss cheese model. As we all know, Swiss cheese has lots of holes in it. And this is a model for schools, but the principles hold no matter where you are in a workplace or in any kind of a gathering. The important point is that each additional measure that you employ will add a level of safety, and that hopefully collectively all of these measures will keep you safe, your family safe, your friends safe, And in doing all of that, you keep our whole community safe. So we're going to go through this again. Do not leave home without a mask, and put it on whenever you are within 6 feet of someone who is not in your household. That's whether you are indoors or outdoors. Keep 6 feet away from anyone who is not in your household. And again, this is indoors and outdoors. If you are around others, even if you're around them outdoors, even if you are at, watching your kid's sports game, wherever it is, if you are anywhere near other people, you just need to have that mask on. Keep your hands clean and away from your face. Get tested if you need to or want to. Please cooperate with contact tracing when we call you. And download the COVID Alert PA app. As a reminder, this is a free app, COVID Alert PA. You can get it in any of the normal places where you would get apps. This app can help protect you and your family by letting you know that you may have been exposed, allowing you to seek medical advice early, to get tested, and to protect your loved ones. This app does not use GPS. This is all based on Bluetooth technology. It does not locate you. And if you do learn that you've been exposed to someone who's been positive, it does not tell you who you were exposed to or where you were exposed, just that you have been exposed, so that then you can take steps to keep yourself and your family, your loved ones, your friends safe. The more people that have this app, the better that it will work. And as we see numbers rising so rapidly in our community, the ability of contact tracers to identify and locate every single person who may have been exposed will diminish. So by having this app, this is just another layer of safety that you have control of, that you can take on your own to help make sure that you're aware if you've been exposed. Finally, I just want to remind everyone, I'm sure most of you know that this weekend is Halloween, and I want to urge everyone to stay away from any kind of indoor Halloween parties. If you're planning to host an indoor Halloween party, if you can move that party outdoors, great. That will certainly decrease any risk from that party. But if you can't move that party outdoors, I want to ask you to reconsider having that event. With the numbers that we're seeing going up so rapidly across our county, and it is happening across our county, indoor social gatherings where people will not have masks on, and Halloween masks don't cut it, are really putting our community at risk. So just a reminder, we have plenty of testing available. That testing is of no cost to you. We will bill insurance if you have it, but the county testing sites will not charge you anything. You do not need a doctor's order. You do not have to have symptoms. We're happy to test you if you just want to be tested, and we'll test people of any age. The one thing we do need is an appointment, and we ask that you either live in the county, work in the county, or go to school in the county to use one of our county testing sites. We will be expanding the hours at those testing sites, at 4 of those testing sites, beginning next Wednesday, November the 4th. Those sites will have expanded hours, are Lansdale, Willow Grove, Norristown, and Lower Merion. And we will announce what those hours will be tomorrow. For the 14-day period ending October the 28th, 30,604 Montgomery County residents were tested, which is an increase of 157 people tested compared with the 14-day period ending October 16th. So this is great. People are being tested in lots of different places. You should get tested wherever it's most convenient for you, but we just want to urge you to get tested if you need to or want to. In order to be tested at a county testing site, you just need to go online at montcopa.org/COVID-19, click on the green County Testing Information button. Appointments open at 8:30 on the day that you would like to be tested, 8:30 in the morning of the day that you would like to be tested. You cannot book ahead. You can also make an appointment by phone, and the phone appointments also open at 8:30 in the morning of the day you'd like to be tested. That phone number is 610-970-2937. So an update on our schools. Slowly but surely, more and more schools are bringing students back for in-person learning. And as of right now, we have a total of 179 students or staff that have tested positive. Now, I want to be clear, that's not transmission within schools, but just in total, we've had students or teachers or staff in total, 179 test positive. As I said in the very beginning, there's no zero when it comes to any of our schools. Given the virus in our region, it's likely that every school will have some cases. So what's important about cases at school is whether or not there's been transmission. And it's very important that we're able to trace their close contacts. So to give you a sense of this, of those 179 students and staff, we are now up to 594 close contacts just within the school setting. So you can see how quickly this can grow larger, particularly if schools are not able to keep the 6 feet of social distancing. Now, if you're within that 6 feet, you're considered a close contact. And so we hope that schools are doing everything they can to keep that 6 feet of social distance. Of these cases, 47 are staff or teachers, 132 are students, and they range pretty equally between pre-K through 6 and grades 7 through 12. They're pretty much equal between those two groups. We have had 2 schools who the Office of Public Health has requested to move to virtual, 100% virtual learning so far this fall, and that's because of linked transmission in the school setting, meaning that there is evidence of transmission of the virus actually within the school setting from one person to another within that school. When the Office of Public Health asked the school to go back to 100% virtual learning, we asked them to do that for a 14-day period. The schools that have had, the 2 schools so far that have had to do this, it's been related to lack of that 6 foot of social distancing and lack of compliance with masking. So it just gives you a sense of where the schools are right now. Okay, just one announcement today before I turn over to Commissioner Lawrence. I just again want to remind everyone that our Office of Public Health is continuing to operate no-cost flu clinics. There are 6 walk-up flu clinics that are open every Thursday in Pottstown, Green Lane, Willow Grove, Lansdale, Norristown, and Ardmore. They will be open every Thursday through the end of November, except for Thanksgiving Day. One note, the weather forecast for tomorrow, Thursday, October the 29th, is pretty bad. So they have decided to not have the walk-up flu clinics tomorrow. They will be closed tomorrow, Thursday, October the 29th. These clinics are outdoors and the weather forecast is pretty bad for tomorrow. We do have one final drive-through flu clinic. This will take place this Friday and Saturday, October 30th and 31st, at the Philadelphia Expo Center in Oaks. As a reminder, the flu shots are offered at no cost to individuals age 6 months old and older who live, work, or go to school in Montgomery County. We do ask that you make an appointment for all the locations. To make an appointment, visit montco.org/flu, or you can call 610-278-5145. And as I'm sure you all know, next Tuesday is Election Day, and we have an additional opportunity to get vaccinated on Election Day at our annual Vote and Vax at the Trinity Lutheran Church, 100 West Main Street in Lansdale. The Trinity Lutheran Church also happens to be a polling place. And for the last several years, we have offered vaccines at that site on Election Day, and it's been very successful. So we are doing that again this year. Flu shots will be available between 1 p.m. and 4 p.m. An appointment is required, and you can see the information for that on the flyer. And then finally, just one more comment about Halloween. For those of you who are last minute in your Halloween preparation, we do have Halloween guidance on our website to have a safe and fun Halloween. You can check out that guidance at www.montcopa.org/Halloween guidance, all one word, montcopa.org/Halloween guidance. And I hope everybody has a safe Halloween. And with that, I will turn over to Commissioner Lawrence.
Okay, good afternoon. I first would like to start with an election update. We are now under 1 week away from Election Day on November 3rd. So if you have not made a plan to vote, I highly urge you to make that plan right now. If you have your mail-in ballot, please return it as soon as possible to one of the county's 11 secure Dropbox office locations or to the Voter Services office in Norristown. And if you're planning to vote in person, please make sure that you check your polling location, and you can do that online. So now I'm going to speak specifically to people who have applied for a mail-in ballot more than 6 days ago and have not received it. These are your options. You can have your ballot reissued by completing the request to cancel a mail-in ballot and issue a replacement mail-in ballot form, which can be found on the Voter Services website and emailed back. You can also visit our Voter Services office to have your ballot reissued. Our office is located at 425 Sweet Street in Norristown and is open from 8 a.m. to 7 p.m. on weekdays and from 11 a.m. to 4 p.m. On the weekend. And you can vote in person at your polling location using a provisional ballot on Election Day if you do not receive your mail-in ballot form. And once again, all polling locations can be found on the Voter Services webpage. So a couple of numbers. As of October 27th, we approved 278,712 ballot applications. And you can no longer apply for a mail-in ballot. So that will be the number there. We have mailed 267,038 ballots. And if you applied yesterday before the deadline, your ballot will go in the mail today. 9,817 ballots have been requested by voters in person at either our Voter Services office or our satellite offices, which closed Monday. And to date, 188,871 ballots have been returned to Voter Services through our drop boxes and USPS. And once again, if you applied for a mail-in ballot yesterday, it should go into the mail today. I would highly encourage people, if you have your mail-in ballot or you're still waiting to receive it, to use one of our Dropbox locations now to return that. All our drop-off boxes will be available through Election Day. They'll be open until 4 p.m. today, from 11 a.m. to 6 p.m. tomorrow, Thursday, from 9 a.m. to 4 p.m. on Friday, 11 a.m. to 4 p.m. on Saturday and Sunday, from 9 a.m. to 4 p.m. on Monday, and from 9 a.m. to 8 p.m. on Election Day. And all of the locations are listed on the Voter Services webpage to drop off those ballots. Ballots placed in the secure ballot boxes are delivered daily to Voter Services and stamped as received. A couple of reminders as you're filling your mail-in ballots. Please use black ink, which is recommended by our voting system vendor. And if your ballot arrived with a marked out black box covering one of the addresses on the envelope, it's okay. Your ballot was printed with your address showing twice on the outside envelope, and the Postal Service asked us to black one of them out. Once you have your ballot, fill it out, vote in every race. Don't forget to check to make sure that you voted in every race, and put it in the privacy envelope and seal it before putting it in the mailing envelope. And then you sign the outer envelope and date it. And the date is the date that you're signing it, not your date of birth. So you can also always go to our Voter Services website, or you can also call at 610-278-3275. And now I'd like to announce the awards for the Montco Strong Nonprofit Resiliency and Restoration Grant Program. A few weeks ago, we announced that Montgomery County's Commerce Department had once again partnered with the Redevelopment Authority of Montgomery County with the support and counsel of the county's Department of Health and Human Services to create a new Montco Strong Nonprofit Resiliency and Restoration Grant Program. The purpose of this nonprofit grant program is to provide 501c3 entities with financial support so they can be resilient for their employees as employers and stakeholders in our communities due to the disruptions caused by the COVID-19 global pandemic. It's also to ensure that our 501c3s are able to be active participants in the restoration of the well-being and livelihood of our residents, communities, and the county as a whole. The application window opened online at 10 a.m. on Tuesday, September 29th, and closed on October 6th at 3 p.m. Today, we are announcing that the RDA has approved 165 out of 183 applications for a total funding amount of nearly $4 million. The maximum grant was $40,000. The RDA has begun the process of reaching out to awardees today to complete the funding process. 127 applicants are receiving the full amount they requested. That's 69% of the applicants. 38 applicants are receiving a partial amount of their grant request, and that's 21% of the applicants. And 18 applicants are not receiving an award, 10%. Applications were reviewed by a multidisciplinary review team for thoroughness and correctness, as well as to determine if the applicant, the proposed use of funds, and the impacts and resiliency needs related to COVID-19 were all eligible within the scope of the program's guidelines and goals. A number of factors were considered in regards to an applicant receiving a partial or no award, including the applicant was determined to be ineligible. They were a 501c6 or a private business, exceeding the revenue limit for the program, or proposing ineligible expenses in whole or in part. I'd like to recognize and thank the review team members, which was comprised of an experienced nonprofit employees and professionals. This was a very different process than our business grant program. We learned a lot about the challenges and scope of the need facing nonprofit organizations and have been able to share these lessons with other counties considering similar initiatives. More importantly, should we have opportunities to do something similar in the coming year, we'll be much better prepared to support our nonprofit organizations. And in addition to the Redevelopment Authority, the Commerce Department, and our Health and Human Services Department, we want to thank the leaders in the nonprofit community for their positive feedback and support of the program. And the full awardee list can be found at www.montcopa.org/MSNP. And that's www.montcopa.org/MSNP. And that concludes my report.
Thank you, Ken. All right, so just announce that our next briefing will be scheduled for next Wednesday at 3 o'clock. And with that, happy to take any questions.
Thanks, Commissioner. This afternoon, we're joined by Todd Shepard from the Delaware Valley Journal and Jim Melwart from KYW News Radio. We'll start our questions this afternoon with Todd.
Thank you. Commissioners, thanks for making yourself available. Commissioner Arkush, of the data and trends that you shared, are any part of that concerning in the fact that they may be differing from the trends that you're seeing in your neighboring counties? So, is Montgomery County an outlier, whether to the good or to the ill, on any of these trends compared to your neighbors?
Historically, really since about the third week of June, Montgomery County has been under a 5% positivity, which is considered suppression of the virus in the community. And we have been there consistently, which is a little bit more consistent place that we have been compared with some of our neighboring counties. Right now, I actually have not seen the most recent data from our surrounding counties. I believe we are slightly better right now at this moment than some of our neighbors, but I don't have the specifics on that.
Great, thank you. No further questions for me.
Thank you.
Thank you. Next, we'll hear from Jim Melwart.
You mentioned an exponential surge, I think was the word you used. If we don't change some of the things we're doing, is the county planning to mandate any changes, or is there a stage where more mandates might come into play?
I do want to be clear that it is the CHOP Policy Lab's modeling projections that are suggesting that we could see an exponential surge under the current scenario. We, as of right now, are not mandating any changes. Our goal is to ask our community to cooperate fully with all of the existing mitigation guidance and measures. And in so doing, we have an opportunity to flatten out this potential spike and continue to be able to keep our businesses open. So many of our businesses are either just starting to get back on their feet or are just barely hanging on. And we will also hopefully be able to get those school districts that wish to have some students at in-person schooling continue to do so. So we're not mandating anything right now, but I do want the message to be loud and clear that we are at an extremely serious point in this pandemic and that people must start to take this guidance seriously. Masks just have to be worn everywhere outside of your house, and social gatherings are really a problem. They are, in this county, they are our #1 contributor to spread. So I know it's painful and I know people are sick of this, but those are the things that need to happen to keep us from finding ourselves in a much worse place a couple of weeks from now.
This is kind of a wonky question, but I'm going to ask it anyway. You mentioned 594 close contacts in schools. With all the steps and recommendations that are in place, is that high relatively? That sounded high to me. Is that high relatively speaking?
It is high. It's a reflection of the fact that not all of the schools can maintain the 6 foot of distance between students with the number of students that they have in some classrooms. And so what the impact of that is the following. If a classroom has each student 6 feet away from another student and they have their masks on throughout the day, they're following the guidance. If one of those students tests positive, then none of those students are considered close contact because they've been 6 feet away continuously. In a classroom where there's a number of students within that classroom where they cannot keep them 6 feet apart, then by CDC guidelines and PADOH guidelines, any student who is within 6 feet of the student that tests positive for longer than 15 minutes is considered a close contact. And we need to do contact tracing on that individual, and that student has to quarantine for 14 days. And that, quarantine is serious. Quarantine means you need to be in a room by yourself. You cannot eat with your family. You need to use a separate bathroom if you have that in your home, or wipe down the one that you do have. I mean, it's serious business.
With, I believe it was yesterday, Philadelphia announced that they can't fully contact trace anymore. They're relying on people to alert any contacts that they had on their own. What does that mean to Montgomery County, and what do you take from that?
Well, Philadelphia is already experiencing a significant surge in cases. And as they announced yesterday, they're at the point where their contact tracing can't keep up with it. You may recall in the early days of the pandemic here in Montgomery County, we were able to do contact tracing quite well for a few weeks. And then we got that very rapid increase in cases, and we were no longer able to keep up with it. Right now, today, our contact tracers are able to keep up. We are expanding our contact tracing teams as quickly as possible. But I also want to just again reiterate the app that is freely available to all Pennsylvania residents. The more people that download that app, That's just another tool in our toolbox that can really help the contact tracers, because that app will locate and notify people who may have been exposed without the individual who's positive having to even remember that they saw that person, or maybe they didn't know who that person was. So our contact tracers really need everybody to download this app and put it on their phone and keep it on, so that it will help make their job a lot easier.
And we're a week before election. Obviously, this has become politicized, and people are going to hear this and say, oh, it's just a scare tactic before the election. Your message to them?
There's absolutely nothing political about this message today. For the last 34 weeks, I have shared factual, data-driven information with our community and never once brought politics into this conversation. And I do not do that today. These are our numbers. This is what we're facing. The facts are as they have been presented every single week. There's nothing different about what we're doing today than we have been doing for 34 weeks. I want people in Montgomery County to take this seriously, and please follow all of these mitigation measures so that we find ourselves in a somewhat stable situation in a week or two, not in a situation of exponential cases.
And if I could really quick, and this is a quick answer, just to be clear, basically, if people do what they've been told they're supposed to do, then that exponential surge would be at least mitigated. Is that kind of your message?
That's our hope, that if people follow all these measures have been proven to work. They've been working here for months, but people are getting lax and people are going indoors more because of the weather. The cold air does make the virus easier to spread. And so people have to really be mindful of how they're conducting themselves in their day-to-day lives. And the social gatherings really need to stop.
Great, thanks.
Thanks, Jim. Next, we'll read some questions submitted by reporters who were unable to join today's press briefing.
Thank you. We have a few questions from Deanna Durante of NBC 10. She's asking if we've seen an increase in transmission in schools, gyms, salons, dining establishments, or bars.
We have seen spread in those places, but not really an increase. Our primary place of spread in Montgomery County are social gatherings. A lot of times, many times, those social gatherings are related to sports, particularly youth sports, but it's stuff that's happening around those sports teams off the field. So we have not seen any particular spikes in any of those places that she listed.
Her second question is, will the county take any action to shut things down or to roll back occupancy, or must it come from the state?
So as I said earlier, that's not our goal. That would be a last step that we would take. We are urging all of our county residents to really fully embrace the mitigation measures that we have described, in the hopes that we will be able to avoid having to mandate further steps.
Her third question, I think you touched on a lot of this earlier. Yesterday, parents in a Montco school district notified a student in school on Monday, and they had a test come back on Tuesday. She's asking if there's any risk of exposure, for the students or teachers, a potential exposure or a potential illness. And what do you say to those parents sending kids to school under those conditions?
So I'm sorry, I don't really know the details of that situation, so I am not in a position to answer that. We can certainly try to get more understanding of that situation and get back to her if she would like.
Okay. And our last question is, we heard in the spring about flattening the curve to bring down hospital cases. And in Berks County, cases are going up, but not the hospital cases. So do you fear that people have stopped taking this seriously?
Well, I'll just remind everyone that just a few minutes ago, I mentioned that here in Montgomery County, we now have 70 individuals hospitalized, which is a 54% increase from last Wednesday. So just in 1 week.
Mhm.
But having said that, the good news here is that our medical community knows a lot more about this virus than they did 34 weeks ago. And as a consequence of that, there's new treatment approaches to the virus. And we are seeing that even when people are hospitalized, because of these newer treatment approaches, fewer people are requiring ventilators in order to help their breathing. So it's hard to know how this is going to play out over the next few weeks. It is certainly concerning that we saw that much of an increase in hospitalization from 1 week to the next here in the county. My hope is that that will also plateau out and we won't continue to see that rise. But if these cases go up in the way that the policy lab at CHOP is modeling as one potential scenario, then it's quite likely that we could see a number of people hospitalized.
Thank you. There's no more questions.
All right, Todd, is that it for today then?
Yep, there are no further questions.
Okay, great. All right. Well, thank you so much, everybody. Stay safe this weekend, and we will see you next Wednesday.